And I'm like, yes, that's
Okay, Valerie.
okay. All right.
Call to order. Roll call, please.
Dr. Moore,
Yes.
Dr. Robinette. Here. Dr. DeGuzman. Here. Ms. DeWitt. Here. Mr. Adamson.
Here.
Mr. Griffin.
Here.
Ms. Johnson.
Yes.
Here.
Yes, okay. Any addition or adoption to the agenda? Time to look at that? Okay, can I have a motion and second to adopt the agenda?
So moved. Second.
Okay, could I have a vote? All in favor?
Aye.
All opposed? Okay, motion carries. All right, approval of the last meeting minutes. I had time to review the minutes. Are there any additions or modifications to the minutes? Okay, hearing none, could I have a motion and second?
So moved. Second.
Okay, any discussion? Could I please have a vote? All opposed? Okay, motion has carried. All right, on down to public comments. Do we have any public comments? Okay. All right, moving on to old business.
That's me.
Ms. Bibby,
All right, so last month, you guys tabled the request from the Springfield landfill for approval of their license to operate in 2026. Since then, we've gotten EPA comments back. They are currently, the only thing that we're needing for the EPA is a slope stability analysis with a seismic slope stability analysis to be performed is what they're asking for site-specific horizontal acceleration coefficients. And they had a comment about the clean hard fill material that the landfill uses, like to build up their road around it, exceeds what is typical for this type of landfill. And so they're asking for triaxle testing conducted on it to verify the strength parameters. So we're moving along. Hopefully, I know the consultant for Tony Smith at the landfill is working on addressing these things. So hopefully they can, I don't know how long it takes to get these stability studies done, but hopefully they have that done and all the calculations work out that we can get them approved.
okay, so, the recommendation that we table this
Table
one?
it again, yes.
Okay. All right, so could I have a motion and second to table the approval of the license for 2026 and for them to continue to work under the existing license?
So moved. Second.
Okay, any questions?
I just have one question. So he's still able to receive and do full operation?
Full operations.
Okay.
Yep.
Okay. All right, so the motion has carried. We need a vote.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffin,
Yes.
Ms. Johnson. Yes. Dr. DeGuzman.
Yes.
Dr. Robinette.
Yes. Thank you. Moving on to new business. IT provider contract, Mr. Crowe.
There is nothing in your packet about this, because this is going to be a continuation of the existing contract that we have with Tech Advisors. This will be our third renewal with them. It will be a total of a 5% increase over last year's contract price, which is kind of on par with market right now. I would recommend renewing for another year with Tech Advisors. They provide me exceptional service and really moving our infrastructure ahead that's kind of been neglected for a number of years. I will tell you, probably in the next couple months, be coming back to you, likely with an addendum to the contract so that we can address some of the requirements that were in House Bill 96 from last year, which put additional cybersecurity pieces that local municipalities have to put in place. If you pay attention to the news, it seems like a new municipality every week is getting hit with a cyber attack, whether it's malware or crypto locking of files. But when House Bill 96 was passed, which was the biannual budget, I helped put into some requirements for local municipalities, and I think some of it's going to cost us a little money. So that's not part of the regular contract. We'll probably have to look at an addendum, but so for right now, renewal for 1 year at a 5% increase over last year's price.
Are there any questions for Mr. Pope?
As you look at that addendum, those are services that this same person can provide.
Yes.
And then could you also like price shop it and make sure that
Sure.
that's the best thing?
Okay. Any additional? Can I have a roll call, please?
Do we have a motion?
Oh, need a motion.
Oh, I'm sorry. Can I get a motion, please, in a second?
So moved.
Okay, motion. Okay, vote.
Ms. Johnson?
Yeah.
Dr. Moore?
Yes.
Mr. Adamson?
Yes.
Dr. Robinette?
Yes.
Dr. DeGuzman?
Yes.
Mr. Griffith?
Yes.
Ms. DeWitt?
Yes.
Okay, motion carries. All right, moving to building closure.
Twice a year, we ask the board to close our buildings for a day for our workforce development. It'll be, again, the spring one this year is going to be on the 7th of April. It'll be at Clark State's campus on Leffel at the LRC building. We do this 2 times a year, one spring, one in fall, and we need your approval to close the building so we can get all the staff together to have these training days.
Okay, could I get a motion and a second for closing the health department for the office day on April 7th? So moved.
Second.
Any questions for Mr. Pope?
Do you have the fall date yet?
I don't think we've picked, it's in October.
Okay. I was just wondering if we could
Yeah.
approve them both.
We didn't, we haven't set that yet. So we do one, Dr. Moore and I were just talking about this. We do one on the Tuesday and one on a Friday. This is a Tuesday
Okay.
in April. So the one in October will be on a Friday.
That was nice.
Hey.
Okay. All right, let's see here. Can I have the roll call for a vote?
Dr. Moore?
Yes.
Mr. Adamson?
Yes.
Dr. DeGuzman?
Yes.
Dr. Robinette?
Yes.
Ms. DeWitt?
Yes.
Mr. Griffith?
Yes.
Ms. Johnson?
Crable Hill Family Foundation Grant. Mr. Cook.
It seems like it's always grant season, but this is one that's a spring grant application. Last year, Crable Family Foundation funded us some seed money to get some of these supplies and equipment that we need for the Bechtel Clinic. If you recall, we're going with a new partnership with the Pregnancy Resource Clinic. They're opening that location. It was the previous Planned Parenthood building. They're opening up a second clinic location in addition to their South Line Clinic, and they invited us to be a partner, and we started having discussions, and so we're going to be able to do some things they can't, and that's basically extending our reproductive health and wellness, our sexual health services to the new location that they're going to be opening. So Crable they were great last year. That $50,000 they gave us last year was able to purchase the Binks machine and a few other things to do the point of care services that we have there. So this $50,000 ask it's some personnel, some operational supplies, and will allow us to. We've committed to BRC for the first year. That's how this money will be spent. And then as we operate at the Bechtel Clinic, we're going to try to do a little bit of billing, a little bit of cost reimbursement through some of the providers that we can utilize, the managed care organizations that we can build to see if we can prop that up so we don't have to make such a big ask. We're always going to probably have to subsidize this with some grant funding, but Crable Family Foundation has been very interested in this new partnership. And so submitting this for this year, you see its grant start date is 4/1 through the end of the calendar year. So just like your blessing to proceed forward with that, and hopefully we'll get that money.
Okay, we have asking for a motion and a second to authorize the health commissioner to do all things necessary to submit the grant.
So moved.
Second.
All right, are there any questions?
So did you already submit the grant? Because this says the due date was February
Yes.
13th. Okay.
Number of our grants that we bring to you have turnaround dates that are before the next board meeting.
Okay.
Any other questions? Roll call, please.
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Ms. DeWitt.
Yes.
Okay. Mr. Cook?
The next grant is the Tobacco Prevention and Cessation Grant through the Ohio Department of Health. I think it's every 3 years. This is a competitive, but this one is a continuation. So the nice thing is when you're in that continuation cycle for this next year, that'll run from July 1st of this year to the end of June next year. As long as you are doing a great job hitting all your deliverables, you have a very high chance of getting continuously funded in this phase. So you see the basic outcomes. This is reduce both adult and youth tobacco usage. And we have a lot of campaigns that Leah takes care of through this. You've seen the show and tell that Leah has done in this room for you. That is that program that she works in. It's funded almost exclusively through this state grant. Total is just a little over $122,000 for this continuation phase of the grant with ODH.
Okay, I'd like to have a motion and a second, authorizing the health commissioner to do all things necessary to, including submitting for this grant for tobacco.
So moved.
Second.
Any questions?
This is just to get awareness out though, right? It's not to provide anything to help people quit.
A lot of this is educational. It's advocacy for policy. We have several programs that we do in the high schools. They're called Think Fast. You've probably seen that on the vouchers. We pay them. It's usually about $1,000 or $2,000. But we'll bring those programs to the schools. It helps support the school resource officers as well, as they have those educational pieces. And again, you saw the big tub of things that the school resource officers take off the kids. So yes, that's primarily what it is. We use the Tobacco Quit line. There are some classes that we host too actually, when you leave, you look at our electronic sign by the road, it has a class that's being advertised right now. It's down at the Springfield Metropolis. So.
Any additional questions? Ms. Hackathorn, roll call.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman, Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. Johnson.
Okay. And Ms. Taylor, get vaccinated for submission.
Yeah, so we've been getting this grant for many years now. We are the lead agency for 2 other counties, Madison and Champaign. Overall, it's just to help increase immunization rates and just provide education. One big change this year that I'm looking forward to, I don't really know what it's going to look like quite yet, is that one of the deliverables is vaccine preventable disease outbreak planning. So the plan will outline protocols for detection, reporting, communication, and coordination during an outbreak. I've not really had that before through this grant, so I'm not really sure what that training is going to look like quite yet, but I'm kind of excited to see that in there.
Nice. And I have a motion and second authorizing the health commissioner to do all things necessary to submit the grant application for vaccine.
So moved.
Second. All right, are there any questions?
I have a curiosity question.
Yeah.
We had talked about previously the vaccine schedule, and that Clark County is going with the traditional AAP recommendations. Do we know if the Ohio Department of Health is also doing that, or are they moving to?
Yeah, so when we haven't received any of the material yet, like the PowerPoints moving forward, but they've said that they're going to try to show both. They're trying to be pretty transparent about it, so they'll put the CDC schedule and then like the AAP schedule. So I think it's going to be in all the PowerPoints moving forward.
Okay. Good question. Any other questions? Ms. Hackathorn, roll call please.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Okay. Moving on to vital statistics. Mr. Cook.
This is a first reading, so no action required on this tonight. So first of 3 readings. So next month we'll have a second reading, a public hearing opportunity for people to weigh in on this, and then a third reading in April, implementation, much like we did environmental health fees last year. This is a new fee, so we are empowered under ORC 370909 to create fees to do business. And this is a new fee that I think several health departments are starting to look at. We're calling this a vital record first replacement fee, and we're setting this fee at $10 per record. As you can see, what's in your packet, this fee is going to be used for the one first replacement of a birth or death record when there is an identified error by the inputting agencies. So that would be a birthing hospital or a funeral home. The state allows us to generate one replacement record. And we don't have to transmit any fees for that record. Most of the fees, when we charge $24, come in here, you get a birth record, death record, charge $24. Most of those fees actually are transmitted to the state, and we retain a small portion of that. But for a replacement record, the state says, okay, you can do one replacement, but you don't have to send us any fees. However, we still have costs involved. And you can see what those fees are for birth record and death record. The paper that we print this on, that certified security paper, is not cheap. So it's almost 50 cents a piece of paper for a death record. And then you can see the breakdown. It also costs us money with our leases of our toner, with our printer, a plastic sleeve to put that birth record in. There isn't one given for a death record, stamp that's being mailed, and then staff time. And that's the piece that we were able to recoup out of that part of that $24 that we charge for a record when they come in to get that. But we're losing money on this. But this isn't a new thing. We've always been able to issue replacement records, but it was really infrequent. With the new state issuance system, if I can just say this, I'm just going to say there's a lot of errors that are being made by the entities that enter this data. We don't enter the data. We issue out of this system. So birthing hospitals, funeral homes are just, with the new system, they're just making a lot of errors. And it's starting to cost us money, real money. So you can see, since the new system was put in place, you can see we've encountered a loss in birth records of just under $300, a little almost $450 in death records. You can see since we adopted, the new system was adopted the 1st of December, we've replaced 45 death certificates. Shannon, how many have we replaced this week alone?
25.
So, yeah, while this doesn't, you might look at this, go, oh, we're lost $500, $300 here. Yes, that's a big deal, but we feel like it's going to start becoming even a bigger deal. And this week it's like almost like we set this up, but we didn't, I promise. With all these errors this week, we're not trying to make money. We're just trying to not lose money. And that's where we came up. You see the justification of $10. Now we can set this at any fee we want. We don't have to say, $9.89. These are the quantifiable losses. There are other things in here. You could start building in utility costs and malpractice and all of our insurance and liability costs, things like that. But these are the ones that I felt like we could just grab our hands onto really quickly and say, these are out the door losses that we're incurring right now, and we need to recoup that. I know that Shannon, you've said you've had a couple of conversations with some funeral homes.
Yeah, we've had a few,
Right.
especially this week, with so many errors, and they all understand they're actually adopting their own policy as well, because they'll of course pass the fee on. So. And they're okay with it. In addition to that, we learned from the state this year, we only get one shot now to order paper. So if we do so many replacements and we run out, then we're out. Yeah. So we would have to try to put in for an emergency order, which could take time and probably extra cost. So just a lot of.
Are these errors because they put a new system in and people are having trouble adapting to the new system? Or do you see it?
Some of it. This week, I'll tell you, it was keen errors. They typed the wrong number or missed a letter in the name.
Oops.
Yeah.
Yeah. So, it's not meant to be, it's not meant to be punitive, but you gotta think maybe one of the side effects of having a fee is maybe we'll be a little more careful, perhaps. But this is something we just, if things don't go in our checks like this, we could just be, in essence, everyone who purchases something from us, or whether you have a levy, is subsidizing the errors, and really the people should be paying for the errors, really, or the people that are making them. So,
Isn't it the person coming, to pick up the death certificate and get a copy? Aren't they the ones who are paying for that?
oh,
They're paying the
Yeah.
funeral home. Most of the time the funeral home comes and picks up the death certificate.
Okay,
We only have people come in, that maybe later need one.
okay.
Most of our business for the death certificate is the funeral homes.
Oh,
They're paying, I'm sure the family is paying the funeral home,
hmm,
and they are going to start imposing a fee as well
okay.
for errors that when
Yeah.
an informant has given them the wrong information.
Hmm.
Gotcha.
Okay. And how about, when the, hospital forgets to notify her,
Well, I don't know.
my kid didn't get notified of having the birth certificate. Yeah, that's a long process when you have to declare that your kid really was born here. Okay.
yeah. So hospitals, when a child is born, they give.
Should give.
They should, but what they give is just, what do they call them, like
Like an
souvenir,
heirloom.
an heirloom birth certificate. It's not a certified. We're the only entity that can, in the state, can
Right.
actually issue a certified birth certificate.
Right. Yeah, because I came here to get one and there wasn't because they never told you.
Oh, the state
Yeah.
didn't. The hospital didn't
hospital did.
register it with the state.
Exactly. So that's why I was asking, who pays?
It's very rare we see it. We have seen it. It's rare. And it is a long process to get it.
Yes, it is a very long process to get it fixed.
You have to go through the court.
You have to go to court.
Okay.
If there is an error with the birth certificate, does the hospital did this charge rewind? Would this charge go to the hospital or to an individual?
To the individual.
I don't like that. Just for the record.
That's why I was asking and stuff.
No, we did say, there are some exceptions.
Yeah, so this is a fee that if, I don't know, I'm trying to think of a good example. We can, since this is our fee, we can waive the fee. If there are some extenuating circumstances, it's not the case with every fee, like environmental health fees. We're bound by law to charge, even late fees. We cannot waive late fees. But since this is our local fee, there will be probably some instances. Do you have an
In
example?
birth, we talked about, if it's a true, we can prove the hospital error, like they'll call us, they know when they made the error. If we can prove it's their error, we said we would waive it. We're talking about errors where they come to us a lot and they have to fill out an AOP, an affidavit of paternity, and they misspell the individual misspells the name on there. And then they come back and say, well, I forgot, I wanted to add an E. Those are what we're talking about, because then we have to fill it out, send it to the state, issue a new certificate.
Yeah.
So those are where it's truly the informant's error.
I agree.
Yeah. Until you're taking your kid to school, you don't know they don't have it. Okay. I lost my train of thought. Okay.
The good thing is you don't need any more training because there's no action required. So.
All right, thank you so very much. Staffing changes, Ms. Hackathorn.
Thank you. First, sorry, speaking of keying errors, I misspelled nursing on the first line, so I'll fix that. We did have some new hires, so exciting. We filled some positions, been open for a little bit. And then I'm going to turn it over to Chris and Lori to talk about our resignations.
Yep, I have the first one. I have a home visitor, FSS is what we call them. She's going to Champaign County, so I'll be needing to fill her position, unfortunately.
And then it's my turn. If ever I have wanted to reject a resignation, it was this one. Zibby, I know you said a couple things before the meeting started about, tears being shed over this. I know it was a tough decision for you. But truly, everybody in this room wishes you everything that is good and the best for you and your family. Huge loss for us here in Clark County. Loss for me personally, because I kind of like you. And we could not in words express our appreciation for everything that you have done on behalf of this board, on behalf of the citizens, of the environment that you have protected through your actions over the last, how many years? 11. I was gonna say 12. Things that you don't see on the front page of the paper, and that's how public health operates, right? Way back in the background. So there are things that you have done in this community that no one will ever realize, but I will tell you, the people sitting in this room realize it and appreciate you very much. Truly wish you the best in your next adventure. We appreciate you.
Yes, we do. And I don't think I'll know how to have a meeting without having you here.
Your agendas will be shorter. I joked with Chris, I said, I saved them all and said, these are all going next month, so I can have an agenda that doesn't have all of my name on it.
Yes, truly, 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 you are good. And we appreciate what you've done. Thank you. Financial reports.
Oh, no, we
Oh.
did.
We hired some people too.
Oh, good golly. Mr. Cook?
I think the directors will mention them in their program reports, but we do just need a motion to appoint those folks.
Okay, I need a motion and second appointing new employees to public health service.
So moved.
Okay. Can I get a vote?
Mr. Griffith,
Yes.
Mr. Adamson.
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman.
Yes.
Ms. Johnson.
Yep.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes, okay. All right. Are you gonna tell us about the new hire?
No, the directors will mention them during their program
Oh,
reports. Yep.
okay, thank you very much. I got confused again.
All right.
All right. Expenses and vouchers.
Relatively, the expense and voucher piece, relatively light. Use that word cautiously. Month, about $232,000 in total non-employee expenditures. 123 of which was a check for fees to the state and $83,000 check for health insurance. So as far as the day-to-day operations, gosh, about $100,000, 112 for the month.
Okay. And that is for the expenses. Can I have a motion and a second to approve the expenses and vouchers?
So moved. Second.
And are there any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. Johnson.
Yes.
Dr. DeGuzman.
Okay. All right, any transfers in advance?
Nothing that wasn't in the budget.
Okay. All right, so no actions there, and the budget report.
Okay. There are about 5 pages in a row here, and I made sure Mrs. Hagethorn got them in the right order because I kind of wanted to flow. The first one you've seen every report I've given. It's called the Ohio Cash Basis Report. Basically it shows the beginning balance for each of our funds, money coming in, money going out, and our ending balance for each of our funds. Okay. The next page you're going to see is what I'm short-term calling the new sheet of many colors. And it is. And if you're looking at that going, boy, this is hard to follow. Down at the bottom of that page, it talks about, hey, these colors divide all of our funds into 7 groups. General, environmental, nursing, WIC, early childhood, health planning, and one I'm terming as limited activity. There's still a balance in there. We're working on spinning it down. We very rarely have revenue, but they still exist. And so based on those colors, right, general is blue and environmental is green and so on and so forth. That's the color coding that you're seeing on the left side of that page. So if a fund is highlighted in green, it is part of the environmental package. The next page at the top breaks down, hey, we have all these funds. Every fund has a 4-digit number. Here's what they are, right? These numbers correspond to the number on the left side of the previous page. But you know, if you're looking, hey, what all makes up environmental? Well, there are about 12 funds there. Right? And you can count them on the other sheet, or you can look here for the short version of it. If we group in those 7 groups, year to date, right? It looks like that chart that's kind of in the middle of that page. We start the year with 1.5 million, and we end the year or in the month with 1.39 million. 329 million. But that shows you fund by, not fund by fund, division. Sometimes I look at stuff graphically at the bottom of the page. I can do a line chart, I can do a bar chart. To me, I like the appearance of this one because I can tell that we took in more than we spent. Right? Obviously, the size of the chunk is attributable to each of the departments, and the colors correspond. The general fund expenses are a little misleading. We approved in our budget over $1 million, well over $1 million worth of transfers and advances. We spent out about 605,000 in transfers and advances, which will show up as expenses to the general fund, and they'll show up as revenues in the other accounts. Right, so that if you look at that and say, boy, we spent a lot out of the general fund, it's a lot of it's transfers. If you want to look at what it would look like on an annual basis versus a 1-month basis, I've got 2025's data for you. Again, broken into each of the divisions. I then have the same type of bar graph for you. All of this is open for discussion. What do you like? What do you not like? And you don't have to tell me tonight. This can be an email. This is an idea of something that I thought would be helpful for the board to see. I have one more page of graphs for you. We've been looking at things by fund and then by division. This is by revenue and expense source. If you want to know, hey, what percentage of our revenue comes in from the levy? Well, in 2024, it was about 26%, and in 2025, it was about 25.75%, right? What percent of our expenses are attributable to humans, right? I will tell you, this is one of the few places I've seen that's under 75% for that number. A lot of places, the people run about 75% of your program expense. We're under that both in 24 and in 25. And then just some very basic pie charts down at the bottom showing for the year 25 where our revenue is coming from as a chunk of a pie and where our expenses are as a chunk of a pie. Again, fully open for discussion. What you like, what you don't like. I don't plan on giving you all of this every month, but I do plan on giving you the new sheet of many colors and probably the bar chart that comes with it and the table that generates that chart. But I can always add more, I can take away. Scott and I talked once upon a time about what you refer to as noise. I want to try and limit the noise. And I want to give you stuff that is meaningful to you. So I am open to any and all suggestions. And again, it doesn't have to be tonight. It can be an email, it can be a phone call, it can be a chat after the meeting's over or before the next meeting. Whatever works for you. That's my goal.
Thank you. I like the colors. And I do like, it looks nice and clean. I like that a lot. Probably the only thing that, and I'll figure out how to get used to it. I do like the categories. They put all the funds up under a category. I just don't like that I don't know without going back to the other page what that was.
Yep.
But I'll figure it out.
I can consolidate that.
But I like it. I clean, easy to read. Thank you. Appreciate it.
I'm just curious, what does CS stand for on the expenses? 2024 and 2025.
Oh, contracted services. Sorry. So like, I know WIC uses some interpreters and we contract through the Clark County ESC for them. So that is contracted services expense.
I also like the divisions, and the look at income and expense for each of the divisions. I think that's cleaner. Like I said, it's less noise. It's easier for us to at a glance look at. So thank you.
Thank you.
Any additional comments? Okay, very nice. Thank you. And public health team reports. And environmental. health.
Thank you. All right, so I had one of the new hires, Sonia Bustos, is our environmental health clerk. She replaced Rita Lewis, who retired at the end of December. She started Tuesday, so she's getting a crash course in all the knowledge that I picked up from Rita for all the programs that she did in 4 days. But so far, she's been here since Tuesday. She's very willing to learn and jump in and get started. She's answering phones. She's been helping customers at the counter. So I think she'll be a great addition to our environmental health team. And then we are right in the middle of food renewal season, and it has been nothing short of a fun and trying time with our new food program that we issue our licenses with, record our inspections in, just a learning curve. Lots of steps to processing the license, so it takes a little bit more time to do those. We normally send them out the end of January. It was early in February till we got them out, waiting on getting our applications able to be pulled out of the system. So right now we've received about a quarter of them back, which is a little less than what we normally would be at this time. So we're fingers crossed that they start coming in more next week, so we don't have a lot of late ones. But Regina's done a great job. She took over the food program just this year, and getting all those processed and trying to get those licenses back out as quick as possible. Then also we just found out today, so all of the rules in environmental health are under a rule review timeline. So typically 5 years, the rules are supposed to get reviewed. They put it open for like public comment time where we can give our input on what we think about the proposed changes to rules. And we just found out that they are getting ready, Department of Health is getting ready to update our Ohio Administrative Code 3701-21, which regulates our food service operations. Right now, it's an informal comment time. So we locally can, at local health departments, can give our input on it. The biggest changes are that they are looking to update the state fee. So for every food license that we issue, there's a local fee that stays here, and then there's a fee that we have to pay to the state. That is currently $28 for every license. They are proposing to up that, so $28 for commercial, $14 for a non-commercial. Beginning the end of this year, upping that from 28 to 47. And then as of 2029, each year it'll go up a little bit, but by the end of 2029, it'll be $53. Half of those fees is what it would be for a non-commercial. For our vending, it will go, sorry, I gotta change my page, from $6 to $26 and eventually up to $29. And for our mobiles, it's currently $28 and it'll go 41 at the end of the year and up to 46 by 2029. I haven't really had time to digest and think or even talk to Chris about, if we want to put in some comments on our thoughts on this. They're also looking to amend some language on our certification, bless you, for food safety protection. But initial thought, even like for a vending, because we can only charge a vending license. So typically with cost methodology, it's all about how much time we spend in the program versus how much time we spend overall working. But with vending, they cap it on how much we're allowed to charge. And then each year we can only increase it by like the consumer price index, which is not a lot. So the amount of time that we spend on vending, we don't recoup in vending fees. But like $26, which would be the state fee, is more than like what we're allowed to charge for us to go out and do the inspection. Like right now, we can charge $14 to do a vending license. So I don't know how that'll go. I can see our vending people maybe having a not happy time about that, just because, I mean, when they have, just in Clark County, one company might have 35 vending machines, multiply over how many they have in the state of Ohio. It could get expensive on their end. Once they go through this informal process, they open it up for a formal hearing. And we will definitely put that out. So that way, anyone in the that body art will overwhelmed by the number of comments, but they went back and readjusted, and they now are opening those back up for comment too. So it'll be interesting to see what their proposed changes are there. But that's something that we'll definitely keep an eye on and make comments on if we feel that it will benefit our county.
Is that tattoos and piercings?
Yeah. So body art encompasses tattooing, microblading, permanent makeupping, body. In over 11 years, their state fees have been the same.
I was trying to think the last time they raised fees. I think I was still inspecting. It's probably been 14, 15 years at least, and it was $21. So they went from 21 to 28. I remember that change. So it's been a long time.
Doesn't make it feel any better.
But I mean, it's if it had been $1 a year for the last 15 years, I don't know, would that be easier to swallow? I mean, that's why, when we do our fees here, we've talked about, do we wait a number of years and then make a big jump, or do we just every year?
Got it by 1,000 cuts.
Gives it time to heal. Yeah.
Thank you very much. Any more questions?
What's your last day? Tomorrow. Tomorrow.
When are they proposing to have these, just so this whole year discussion or?
No, so Chris, you can be more on the actual timeline, but they will comment time, which is pretty much local health departments, is who they open it up to. And we have to have our comments in, I think it's March 13th. If I remember right, correct. And then they will review those, make adjustments if they feel they need to or something. And we'll finalize everything and then it goes to JCAR, right?
Right. The one step that's in between all that is something called the Retail Food Safety Advisory Council, or RIPSAC. That's in statute. I'm actually the health commissioner's representative on that. And I will tell you, I mean, those meetings have representation across the board. Industry's there, academia is there, local health departments are there. And so there is a meeting scheduled, RIPSAC meeting for the first day, April 6th. Say that to the members of the council, including industry, and start, having, frankly, they're giving negotiations. I foresee that happening. That's how it works, right? You remember Schoolhouse Rock, right? Negotiations are part of it. So.
Yeah, so, and then they give you JCAR goes through their whole process and then they say, okay, these will be effective this date. So it's going to be, it's not going to be until, these proposed changes aren't set to take effect until the first one's October 1st. So.
Okay, one more question. All right. Nursing and clinics, Ms. Taylor.
Yes, I've got a couple things to go over today. The first one is that the second new employee with ours, Emily Freeman, she's an LPN. She started the same day as Ms. Gibby did on Tuesday. I'm so excited to have her. The communicable disease report that the epidemiologist put together. There's one correction I want to do, and it's on the TB line. It says on it that there was 9 active cases for the year, but there were 8. And the correction is because there was only 1 in Q1. We have 2, but that second case was actually diagnosed outside of Ohio, and then they moved to us, so that can't be in our numbers. So they fixed that. Unfortunately, it was just too late to put it in. And then, so if you go back, I'm just going to use probably everywhere, but if you have to begin, there's a picture there, and that is 2 out of 3 of our CMH nurses. So that's Tony and Ashley. Ned is not pictured, and I just wanted to give them a little bit of a spotlight, because I feel like where they're not in clinic all the time, they don't really get spoken about. I'm a statement is Ned, time to ensure that Ohio families with children or young adults who have complex medical needs can access care and reduce out-of-pocket costs with hands-on support from public health nurses to help coordinate services and navigate payments. There are 3 different programs. It's a diagnostic program. That one has a much more broader diagnoses that qualify for it, and it just helps for diagnosis itself. And then there's the treatment program and therapies and then the third is service coordination program. So it's locate and coordinate care, because you have to, then I just want to go through one situation that we had this fall, and I have got scribbles and everywhere in here to take out patient identification. So if I stumble through it, just give me a little bit of break there. But so this happened with Ashley. She's genetic and other conditions and was transported immediately after birth from a birthing hospital to a higher acute one. This child's extensive issues required surgery. Long-term NICU stay, home care service. I had mentioned little of the underlying conditions. It wasn't until speaking with mom via phone and visiting the family that the child's needs for program coverage were determined to be much throughout the course of the next several weeks. I actually worked with the CMH program. The goal was being to get the child on the treatment program to cover expenses related to the child's qualifying medical conditions after private insurance and Medicaid have paid, leaving the family with as little out of expenses possible. After many unsuccessful attempts were made for the hospital to provide the documentation needed, they were denied this coverage. So with extensive help from Ashley, they submitted an appeal and they ended up winning it. So appeal case was won between reprocessing all claims and all insurances and CMH treatment program. The family debt of $3.5 million was relieved. The case is still evolving and ongoing as child's needs continue to evolve. So Ashley says this about it. She says, this case was monumental and took numerous hours to complete and follow through, but it was extremely worth it for the satisfaction and relief for the family. I'm getting a little emotional. This is a some
about potentially our Help Me Grow caseloads draw a lot of immigrant families in summer on TPS and different levels visits. So I'm a little bit concerned, but of course we don't know what's going to happen. We don't really have a definite timeline. So I just wanted to mention it because it is a little bit of a concern for us. But on the brighter side, somebody called me from the library. Her name was Miss Stewart, and they have an adult program at the library evidently, and they get together weekly for camaraderie and they craft. And she wanted to know if we could from the fruits of that, and I said absolutely. So they brought bags and bags of these beautiful handmade, handmade quilts and crocheted blankets. It was really big. And then they brought adult hats, which I so wish we would have had. We've been out and we get hats all the time by now, but we'll see for next year the ones that can't come out this year. But they brought ones. I've not seen these. They brought soap, crocheted soap dispensers with soaps in them. They brought scarves, and they brought some bags.
Oh, nice.
Yeah. So the families out, and there's another. Oh, there's one of those things that go around your ears. But there was scads and tons of them. So we've already started passing some of them out, but we'll, like we said, we'll put the other ones back next winter. But what a great collaboration that we definitely have the families in need, and they had the desire to pass it on.
Very nice.
So, public library.
Awesome.
That's all I had. Thank you.
Thank you. Health? Oh, no. Women, infant, and children. Schaefer.
Thank you. I want to highlight, we just completed our first year of WIC visits at Springfield Regional Medical Center. Partnership allows that direct integration of WIC services into the hospital setting to ensure mothers and infants receive that immediate patient support. By providing benefit enrollment, breastfeeding support, and food packages prior to discharge, families leave the hospital with essential resources in place. And I just wanted to note some key takeaways. This process has reduced the demand for our in-clinic appointments, and significantly decreased program engaging predetermined participants and enrolling families who have never accessed WIC services. It's eliminated the need, which is reducing stress, transportation barriers, and financial burden for families. And it allows for early referrals to breastfeeding support and primary care providers. And overall, the hospital certification approach improves service efficiency, strengthens care coordination, reduces barriers for families, and enhances health outcomes for mothers and infants. And the total number of participants served, which I'm just kind of astounded that Ashley was able to do this from last February to this January. So I thought that was pretty awesome. Staff, the nursing manager, she's pictured there with Madeline, who's a social worker, and they work very closely together. So it's all just been a really team collaboration to get this underway, and it's just been thriving. So she's excited to continue this journey, this mission. So I just wanted to highlight that.
I will speak and manage actually also because I teach clinical on Fridays there. And she is amazing. She's always everywhere. And yeah, I just this family was talking about XYZ and I'll go see them. Thank you for letting me know.
Yeah.
She does a great job.
Very nice. Thank you. Health planning, Mr. Cook.
Well, I'm going to pinch hit for Gracie tonight, but I do want to mention one thing. Ashley, you're right. Jesse, Ashley's great. She's done a great job. It's one of these things makes you go, man, I wish we would have done this years ago. But, over the last month, serving just under 800 people, it's awesome. All right, so a couple things to highlight out of Gracie's report and health planning and Jacob's report too. Safe communities. We're working to start our first round of seatbelt checks this year with our local schools. It's always kind of a fun thing that folks do, and it raises awareness of wearing your seatbelt. Kids get some candy, and then they also have an opportunity to get coupons from Chick-fil-A and Tropical Smoothie, so good partnerships there. The first seatbelt check is scheduled for the end of February. So I'm looking forward to that season kicking off here soon. Yesterday, Leah Baylor went with them, and she's been working. She's actually had several meetings in the evening here in this room to kind of train this youth council for Advocacy Day. And what they were doing is they were going to the State House to let our state reps know that they're being targeted by tobacco and nicotine, and just giving that knowledge and that confidence to our youth to have those conversations at the State House. And they had a great day yesterday. I think we'll have some pictures next month in there. It's a great partnership with partners here, and Leah does a great job with that. And then finally, if you look towards the end of Gracie's report there, you'll see some pictures, a partnership with Second Harvest Food Bank. We already have a relationship with them, but we did something we've never done before. We asked the staff if they wanted to volunteer. So one evening off the clock, true volunteer time. We had 9 staff members sign up to volunteer, and you see some pictures there of the folks that volunteered to pack boxes of food. A very humbling experience for the folks that went. So just appreciate that time that was donated to Second Harvest Food Bank on behalf of our staff. That's it.
And Mr. Cook, legislative updates.
Stick with me for a minute. Before we get to the legislative piece of this, I just want to let you know that we have produced our first draft copy of the Community Health Improvement Plan. I actually saw it on Energy's desk today. That's going to be the final version, is going to be published in the next couple of weeks. But if you recall, that is our blueprint for the whole community for the next 3 years, priority areas. We have SMART goals in there, things that we want to achieve as a community, not just the Borough as the health department. So we'll be looking for that on our website here in the next couple of weeks. It looks great. Energy always does a great job with that, and she did not disappoint again this year. So legislatively, mention a couple things. A couple days after our January Board of Health meeting, HHS sent out a memo. It was on a Friday night saying that we're going to pull back your emergency preparedness dollars to everybody across the nation. And Everybody kind of freaked out about that. We were having flashbacks to March of last year when we got enhanced operations dollars back on the rug pulled out from under us. But there was so much immediate pushback that by midday Saturday, and they restored that funding. So it had a happy ending, but this whiplash that we're feeling on the local level is palatable. It's real and it's having impact. I don't know what to do at this point. To the locals. So we're good. But still, it's exhausting sometimes. A couple of things that happened. The CDC's grants terminated 4 states that have got to public health. California, last week, very heavy on the public side, public health side of things, total $600 million. These were previously grants that they clawed back and pulled back. They were in the areas of public health infrastructure, emergency preparedness, HIV, STI, and so again, another legal battle, another big bucket of whiplash being poured down on locals. But again, public health is not supposed to be partisan, but we see that it is. Locally here, let's talk about some House bills now that our local legislators are back in session. There's a few I'll just toss out to you. House Bill 578, requiring the reporting of tick-borne, tick-related diseases to the Ohio Department of Health. That is actually not the case right now. So that would require, when it's diagnosed, it's reported to local health department and to Ohio Department of Health. This is one that AOHC, Association of Ohio Health Commissioners, is supporting. House Bill 561 is nicknamed the Choice Act. There's some concerning things in here when it comes to the realm of public health. This would remove the requirement for hepatitis B vaccines for kids in school. It would make some alterations to the request for exemptions for required vaccinations in school and attendance. And the one that's most concerning to me, it would prevent schools from excluding unvaccinated kids during times of outbreak. So if we have a measles outbreak in a right now, excluded kids are unvaccinated, so it's one of our controls to prevent the spread of the most highly contagious disease in the world. And that would remove those abilities to exclude those students that were unvaccinated. So be anxiously watching where that's going to head in the state legislature. Another interesting bill, there's a Senate bill and a companion House bill. It's Senate Bill 230 and House Bill 629, basically would authorize pharmacists to diagnose and treat a variety of acute illnesses. And so it's very interesting. There's actually already some rumblings of pushback from pharmacists not wanting to do this. And so there's a list of what we would consider acute or minor health conditions that would allow them to do that diagnosis and prescribing. So we'll be watching how that moves, but I do believe that there's going to be some pushback from the people that would benefit from this, so to speak. I'm all for access, but I don't know. I know there's a couple providers in the room here. I've got some underlying concerns about that. No disrespect to our pharmacists, but we'll leave it at that. House Bill 640. It's got it mirrors another House bill that I previously talked about, which was House Bill 840. This changes some of the laws around sewage and the sewage laws we've had in place and untouched since 2015. It would do a variety of things. It would eliminate soil surveys, which is critical. I'm sure you're shaking your heads, Zibby. It would put in a lot of systems that would fail very quickly. It would eliminate the post-install inspection that happens at the 12-month mark, make sure things are operating well. And the biggest thing, it would change what's called the operation maintenance program, where we go out and look at our aerators and other systems every so often. We basically eliminate that. And so I think you would have a lot of issues that we see every time we go out and inspect these things, failing systems, sewage entering our clean waterways. So this would really change some of the core tenets of our household sewage treatment system rules that have been in place since 2015. You know, see how that moves. You know, have on both government and public. I think that's the big ones that I just want to show you. Things that are going, as you know, I'm paying very close attention to that as we're going to be putting our renewal levy on this fall. To give you an idea, there's been a couple of policy briefs by Policy Matters Ohio talking about what the impact would be in Ohio losing property taxes. So anyone, if you know, maybe read the news, want to guess how much property every year? Just over $21 billion every year in property taxes. So the question is, how do you replace that if it just goes away? So for our parks, our senior centers, our health departments, our police, our fire, our EMS, our roads, all of that are tied to property taxes. And so, as actually, how would you back that? You have estimated that if they went to sales tax, so we drop property taxes and supplement it by sales tax, your sales tax would rise to between 8 and 20%. Super fun buying a car, right? If it went to an income tax base, it's estimated that the income tax would rise between 11 and 15%. So something's going to happen, because if not, municipalities are easily going to go, you're never going to get rid of it. You're not going to have police, fire, EMS. You're not going to, so it's not as simple as the folks that are trying to get signatures for this to be on the ballot would make you think it is. And if that went into effect, I will tell you, we basically would have 1 year. So if property taxes dropped away, we would have payments through 2027. But then after that, something would have to go in place to supplement it. And it's those ugly numbers that I told you with sales tax and income tax are going to be hard to reconcile too. So it's going to be interesting, to say the least, over the next few months. That's it, unless there are any questions.
Any questions? Okay. Executive session? No. Is there any additional business? Anything else you wanted to talk about that we didn't have? No.
Not necessary.
Next meeting is going to be set for March 19th, 2026. And if no objections, I'm going to adjourn. But I have a vote, please. Oh, first, we got to have a motion in a second.
So moved.
Second.
Okay, now can I have a vote?
What's the?
Yeah. Aye.
All in favor?
Aye. Okay, opposed?
Yeah.
Okay. Yeah, this is short meeting, yeah.
Yeah.
We're adjourned.
Yeah.